Hi everyone, and welcome back to our video series on postpartum exercise. So this is for women who are 6 to 8 weeks postpartum and cleared to return to exercise and need a way to gently get back into that type of activity. I'm a pelvic floor physical therapist, and so I'm here to help guide you guys back into safe pelvic floor and core exercise. If for any reason you feel increased pressure, you feel pain, back pain, you notice any like bulging in the pelvic floor area, any bleeding, anything, just please stop, rest, and check in with your provider. Just go at your own pace, go nice and slow. Slow is where we build strength. Today all we need is a yoga mat and a resistance band. So a loop is ideal. I have just like a light one that we're going to use today to get into it. So let's start with our little bit of a warm-up. We're going to get our rib cage moving and our breathing going. So I want you guys to put your hands on your ribs, and we're going to do about 4 nice deep breaths in through your nose for about 4 seconds and out through the mouth. And you want to feel that rib cage expansion, your ribs moving into your hands as you inhale. And everything cinches back in as you exhale. Good, a couple more. Good. All right, now we're going to move our pelvis. So we're going to do some pelvic circles or pelvic clocks. If you're not sure, you're just going to grab onto your pelvis, your hip bones. You can start with just the forward back tilt. It's all right if you have to get kind of everything moving. Can't isolate quite yet, that's fine. But then you get the front and back movement down, then we're going to move into like some circles. Just roll in the hips in circles. Good. Couple more. And then reverse it the other way. Make sure you're still breathing, no holding your breath. Good. And now let's open up the mid-back thoracic opener. So you're going to inhale, reach up to the sky. Exhale, bring your arms down into like a cactus pose. Good, a few more just like that. Inhale, reach up. Exhale, bring it down, set those shoulders down. Of course, my fan pulley is right there. Inhale, reach up. Exhale, bring it down. Try to make sure you're keeping your ribs stacked over your pelvis. Good. All right, now we're going to get into working our core. That's what I've written down, so that's what we're going to do. So we're going to lay on our back on our mat. Okay, straighten everything out, adjust, make sure our back is down, nice and long. Shoulders are away from our ears, neck is long. We're gonna start with heel slides, working on that core connection. So, fix that. Okay, so as you inhale, belly rises, exhale. Think about bringing those hip points together. So we're lifting up like we're zipping up. Pelvic floor is not clenching, but it's lightly contracting or engaged. You're going to keep that contraction. As you inhale, you're reaching your leg out. You exhale and you slide it back in. Inhale, reach. Exhale, draw back in. And the whole time we're trying to keep that abdominal brace our deep core muscles and keeping our pelvis as steady as we can on the floor. Inhale, reach. Exhale, bring in. Side, even it out. Good work. Okay. Good. You can let everything relax. A couple nice belly breaths. Good if you need to take knees side to side. Stretch that out, and then we're going to move on to our next core connection exercise, which is a bent knee fall out. So we're in the same position. You're going to do that same zipping up the abdominal muscles, engaging the core. So you're going to inhale, exhale, zip up, engage that core, neck long, shoulders down. Our spine is long and we're keeping that spinal neutral position. And then you're going to inhale, drop one leg to the side. Ooh, nice hip hop. Exhale, bring it into center. So inhale, I'll show you in the next one. Exhale. So you know you're doing it wrong if you feel like your whole body wants to twist and that opposite hip wants to come up off the mat. So if I'm doing this, I'm just really kind of flopping all over the place. I'm not practicing that core connection. So it really needs to be controlled within a range that you can keep your abdominal muscles engaged. So if we need to reset, it's fine. We just inhale, exhale, zip up those muscles, up and in, and then we're going to inhale, with the leg out, exhale, in. And we're just going to keep that going. You need to reset at any point, you do that. If you notice you're, lifting up in the head, keep the spine long. This is why we go slow, because we want to build body awareness and get back in touch with what our body's feeling and how it's healing after giving birth, whether that was just 6 weeks ago or a little bit longer. Good, one more on each side. Good. All right, now if you want to do a little stretch, please do. But as promised last week, we're going to build on some of our marching and the arm raising movements and move into a dead bug progression. So a dead bug is basically moving reciprocal body parts while keeping that core engagement. So you're going to exhale, draw the belly in, and now we're adding an opposite arm and leg reach. Inhale, and then exhale to lift. So my leg is moving into tabletop. My opposite arm is moving back overhead. And you're just going to keep breathing. Try to keep that spine long, shoulders down, even as you're reaching that arm overhead. And same rules, you want to keep that pelvis level. Stacked from my pelvis, so I'm not popping up through my chest. Do one more on each side. Good work. All right, and that is our core connection series for today. Now we're going to move on to some hip hip strengthening. So we're gonna come onto our sides and do some more of those clamshell exercises. So we've done some of these before. We're gonna do 6 to 8 reps on each side today. So you're just in the side lying position, your feet stay together, and you're lifting that top knee up while keeping the feet together to move into that clamshell. And you want to feel it right here. So if you're not feeling it in your glute, sometimes it does help just to tap that muscle and wake it back up and say, this is the one I want to work. If you're finding that you're rolling back, you can use your hand to keep your back steady, or a little brace on the floor help you maintain that core engagement, but you're breathing the whole time. You're gonna make sure you exhale as you lift, inhale as you lower. Good. Let the record show. I'm a terrible counter, but I think that was about 6 or 8 or more. So we're gonna flip to the other side and give that hip some love. So I'm on my side, feet together, knees bent, and exhale to lift, inhale to lower. And I feel myself rolling back, so I'm just gonna nudge myself forward. The more forward you are, the more that hip has to work against gravity, and it's more work for it, so it's going to help you build more strength. Similarly, you build more strength on that eccentric lowering phase, so I definitely don't want to go up and then just flop. That's missing out on most of the goodness of the exercise. So you really want to inhale slowly and control that leg back down. Once again, I've lost count, but we got it. We go to fatigue around here most of the time. Okay, so we're still on our side. We're gonna work more of our glutes, but we're gonna move into a straight leg raise. So that bottom knee can be bent for stability, but your top leg is the one that's gonna be lifting, so you want it straight. I also really want to make sure that we're not lifting forward, but you're driving your heel kind of back on the diagonal to get more of that glute engaged. So as I lift, I'm going to exhale, lift, and I'm really driving my heel like back towards the corner of the ceiling. Inhale to lower. Good. As I exhale, I'm also engaging my core for support. I think that ought to do it. Let's move to the other side. Switch over. Oh yeah, I think we're giving you some extra reps today. Okay, so bottom knee bent for stability. We're all the way up on our side. It's gonna be really hard if you're just laying halvesies. So all the way up on your side. Arm down to support. Make your adjustments. And we're gonna inhale. Exhale to lift that other leg. Up and back. No creeping forward. Doing great. Keep breathing. Control it. Go slow. sideline stuff. Great, so now we're going to move into a quadruped position, which is just hands and knees position. So let's start with, I'm changing the order up on the fly. I want to start with a rock back. So it's going to help connect our core, but also give our hips a little bit of a stretch after that. So hands and knees. Good. We're going to make sure you're driving your feet and your shins into the floor. So we're not just putting all this pressure on our knees. Your shoulders should be stacked right over your hands and wrists, and your elbow creases pointing forward gives you a little more rotation in your shoulder to take some pressure off the wrist. So here we are, and we're just gonna work on driving those hips back and forward, keeping that neutral spine. So tailbone nice and long. Bring the head up. You're just not collapsing into the ground. And you go at your pace. Okay, little wrist circles if you need, and then we're gonna work on arm strength while still keeping our core stability in that hands and knees position. So roll it out. If you want me to do like a little reverse prayer, that could be helpful. You know, if you're not used to that position, it just takes a little time to build up the strength in the arms for the support, but that's what we're gonna work on now. So here we are, and back in our quadruped position, and we're gonna exhale to raise one arm up, inhale to bring it back down. Now the whole time, I'm not just letting my belly flop out, I am engaging my core, lifting those hip points up and in, and stacking my ribs in line with my pelvis. So I'm not super dropped or super flexed, kind of in that neutral position with my core and my pelvic floor engaged. And we're moving back into it. So exhale, arm up, inhale, bring it down, and keep that going. Make those little adjustments as you work. So, am I still pushing away from the ground, or am I dropping into my shoulder? Is my neck nice and long, or am I moving into turtle position? Am I still engaging in my core, pelvic floor, or am I pushing down in my pelvic floor instead of lifting up? We want the lift up. Good, even it out, one more on each side. And great. Stretch that wrist out again, move a little bit. Open up that back body, whatever feels good on those in-between moments. Just move the way it feels like your body wants to move. A lot of times our body knows, we just have to listen to it. Okay, so we have one more exercise in this hands and knees position. If it's not working for you and you need a break, feel free to go into a counter, like your tabletop, go onto your chair or sofa. But we're gonna be doing hip extension in this position. So I'll demonstrate, but you can also use a band for a little extra resistance. But all the same rules apply. We're engaging our deep abs, pulling in that deep not going really big yet, just doing a small lift and switching. And that's what it's going to be. Now, for those who want a little more work, we can put our bands up and above our knees. Try not to be too rough about it, but it's nice when it's nice and smooth. Okay, so here we go. Now we have a little bit more of the gluteus medius having to work to keep that hip abducted. And now we just have a little resistance. Really press away from the ground. Don't let your body collapse, even though we're taking away support of one leg. So you reach, and how would you lower? Remember, just small ranges for now. No big hip kicks unless you've been doing this a while. Breathing. Look, your head should be, well, your eyes should be looking straight down at the ground. That way your head is in neutral alignment, so we're not trying to crunch the neck up by looking up. Good. Even it out, one foot on each side. Good work. All right, same thing, roll out the wrist. Little reverse prayer. Prayer pose. Go. And good. Okay. We'll keep the band on. For those who have the band, you don't necessarily need it if you don't want it, but we're going to keep it above the thigh as an easier version of our side steps. If you want a harder version, you move the band down closer to your ankles, or the hardest would be having it down at your feet, so I can show that, but we're just starting, so at the thighs is a good place to start. So you're going to be kind of in like soft knees position, almost like you're going into a squat. And soft knees, hands out front. And then we're going to do these nice wide side steps, working our hip stability and a little functional strength by getting up and moving on our feet here. So you're going to think about gliding side to side, not sliding your feet, but taking those steps. If that's too easy, move that band down closer to your ankles. You might have to keep a little wider stance if your band is looser or lighter, and then take a really wide step out. And I'm breathing the whole time. My core is engaged. And I'm really trying to think about how my body is moving with each step, making that mind-body connection ever stronger. For the hardest version, if you have it at your feet, it's along your lever arm. You're gonna feel it a lot more there in the hips. Good, even it out. And I think that about does it for that one. Okay. Let's see, what's next on the list? Oh, I thought so. Okay, so if you need a cushion or something for your knees, feel free to grab a pillow or something soft for them, because we're going to be in this tall kneeling position. So I'm still wanting to drive my shins and my feet, tops of my feet down into the floor for support, so I'm not just balancing all on my knees. That is the position. And think about squeezing those glutes and stacking ribs over pelvis. Up nice and tall. We're gonna use our band again, arms straight out in front. We're gonna do like a bow and arrow movement. So we're gonna get our obliques and our scapular muscles strengthened. And we're gonna do nice alternating movement. Exhale, and then inhale as you come up. Good. Keep those shoulders away from your ears, neck long. Twist with it. Good, a few more on each side. Just show you from the side view. Really using my glutes, my core. Stay upright and keeping those ribs stacked over my pelvis. Good, even it out. Good. Okay, I think we did it. We're on to our resting part, our stretching and cooling it all down. That was awesome. We're getting stronger every day. So, yay us. Okay, where can you see better? I'll turn sideways. So we're gonna just do a forward fold. Yeah, let's do that. Okay, so your legs, your knees don't have to be perfectly straight. We're just stretching it all out. So knees can be a little bent, and you're gonna fold forward at the waist. Reaching forward, rounding the spine, letting everything go. Letting go of all that tension, all that hard work you've just put in. Nice deep breath in through your nose and feel your belly expand into your legs. Your back is opening up. Everything is just releasing and expanding. Now we feel some of that tension go. Keep moving a little deeper into that stretch. Breathe. Good. Rest. Move in ways that feel good to you. You can straighten out the legs a little more and reach more into that stretch. 2 more breaths. Good work. All right, now I'm going to use my sofa, but we're going to stretch our piriformis, our hips a little more. So we're going to lay on your back. You could use the wall, a doorway, a chair. And we're just going to cross one ankle over the other knee. And let that stretch settle in. If you want a little more, you can gently push that knee away. Or you can move side to side. Find where you feel more of a pull in your back of your hip. If that's not quite enough, you'll reach through your legs, grab that knee that's bent, and pull side to side. You can keep the pressure on the knee as you move side to side. Good. If you want a little more stretch, reach through and pull the other knee towards you. Great. Now we're in the perfect position to release those legs up and supported. A little pillow under your hips if you'd like. Even your hands work just fine. Let's give ourselves a little pelvic rest. And just be so proud of yourself